Using a glucose meter, the average reading for older adults without major health conditions should be between 80 and 130 mg per deciliter, in the morning, before any meals. With multiple health issues, the targeted level before meals reading should be no higher than 180 mg per deciliter. After meals, it should read higher, but less than 200. Many times, the inaccuracy of a reading from a glucose monitoring device is not from the unit itself, but rather the user. Noncompliance with the specified scheduled use of glucose monitoring devices by users is common. Furthermore, device users may not fully understand the proper procedures for operating the device. It is important for caregivers to routinely assess the resident's ability and understanding of the glucose monitoring scheduled, as well as proper use of their devices. For example, many residents may not be aware that if there is insufficient blood on the test strip, the meter may not be able to read the glucose level accurately. If the meter is dirty, or contaminated with old blood, grease, or dirt, it can also alter the reading. Monitoring devices are intended for single-person use, in order to prevent blood-borne pathogen contamination. It is important that the user washes their hands before the test, because any amount of sugar on the fingertip can affect the reading. Compatibility of the test strips to the meter and expiration on the test strips should be checked regularly. Because some of the more complex devices may be too difficult for some residents to use, residents with diabetes should be encouraged to try different devices, and a healthcare professional should assist with the selection to help ensure a good fit between the device and the resident. If the resident requires more assistance in this area, request the physician to order a diabetic specialist to come in for an evaluation and education. There are many types of monitors ranging in price, ease of use, size, and portability. There are also glucose monitors that have instructions in Spanish and other languages. The physician or diabetic healthcare providers will advise on the frequency of blood glucose monitoring, based on the pattern of the glucose read, type of diabetes, age, and other health conditions. The next sections will explore medication management for the individual with diabetes.